Well, the 2048 group is an amazing group of health policy experts, clinicians and practitioners who have come together over the last 2 years to pool their collective wisdom and come up with new ideas to help with the urgent task of reforming healthcare in the UK.
Patients should definitely be encouraged to take responsibility for their own care, where that's appropriate and where they're able to, I think.
I developed something called rheumatoid arthritis at the age of 3. And so I've been living with that as a chronic condition for nearly 60 years now. When I was at university in 1973, I learned something called transcendental meditation. Really, just the theory was to help me cope with the stress of my finals. But I found that began a whole process of me beginning to sort of self-manage my own condition. And using that meditation as a basis, I was then able to analyze for myself what foods suited me, what activities were good for me, what activities were bad for me. And I became effectively self-manager of my condition.
So actually we are empowering patients more to own their condition a bit and giving them the tools to help them manage their condition when they're unwell without always having to resort to seeking medical help.
Ideally, if we give patients better access to technology and better access to information, we can empower people to look after themselves better early in disease pathways, in a kind of more preventative manner, so the kind of burden on patients of complicated long-term conditions become less. But we're, I think, behind other industries in working with users of our service, both to design the service, but also to allow them to look after themselves. We do the job of bank clerks now and are happy about it. We should be doing the jobs of some of the kind of frontline staff in the health service and, saving time and becoming better informed about our healthcare, so getting better outcomes and a better experience.
I think that involving patients in their own care involves, first of all, having a better narrative with patients. We know from research that clarity is reassuring. And when patients have a clearer understanding about what they can expect, medicine's not necessarily a precise science in many aspects, but giving people a clearer understanding about what they can expect, what the outcomes are, really helps people to understand the patient journey. I also think better quality literature, information, better quality websites that people can see and understand more about their conditions. But the key thing is to get the narrative better with the individual.
At the moment it's a sort of fast care service rather than, i.e. fast food, not very nutritious, and tending to rush from one patient to another rather than sitting down with patients with serious problems and saying, right, we're going to help you develop a program which really you can do something about and which will help you in the next a few years.
I had a number of agreements and disagreements with doctors over the years, but I think one very good example is that when I'd gone to university, my rheumatologist had said to me, "You're, quotes, an intelligent young man. I give you the freedom to vary your medication as you seems appropriate for you." But after I'd been meditating for 2 or 3 years, I realized I was getting much better and I could probably remove my medication altogether, which I did very, very carefully, talking to another doctor that I knew about it. And I came completely off my medication. And I very proudly went back to my rheumatologist and told him, and he was furious. And he said, "I never gave you permission to stop taking your medicines."
I think the patient's role in the NHS has changed tremendously. When the NHS came into existence in 1948, the NHS was very doctor-centric, and it was organised around the needs of doctors, around the needs of organisations, to deliver what was best for them. Quite rightly, over the last 60-odd years, the role of the patient has been much more empowered. It's much more now based upon a more mutual relationship about sharing, understanding, to make sure that the patient's perspective is brought through.
When I was a medical student, there was quite serious debates about whether you should even tell people their diagnoses, and we were incredibly paternalistic about the way we approached care. That's been transformed in a way that's different and enormously positive, but does mean that kind of interaction with people, the kind of one-to-one interaction between healthcare professional and patient, the kind of balance has changed.
Generally speaking, I think we've got a younger group of patients coming through, say under 50, under 55, who are far more comfortable with a more partnership arrangement with their caring agency, with their doctor, their nurse. They want to have a genuine partnership. They want to know what's going on. They want to know what their options are, what the choices are, and they want to be very much in control of what's going on. But here's the other thing. Another interesting dynamic as we move to a more patient-involved NHS is we're looking at patients as complete people who have educational needs, who have a job to go to, who have leisure interests, who want to learn to play the guitar, who want to do a yoga class. We have to factor these sorts of things into living with their disease and in terms of what they want to do alongside their disease.
I think other things that we can do to make patients more involved are give them access to their records. So again, there's a lot of fragmentation over recent years in the system. So patients may have one health record that's held at hospital, another one that's held at their GP, another one that's held at the out-of-hours service. And if they move to another area, the hospital record doesn't follow them. So there's a lot of patients having to explain themselves to multiple health professionals again and again. And actually in this day and age, that's completely unnecessary.
My health record should be my property. I should own them, I should understand them, I should give permission for other people to consult them as and when necessary, rather than being deprived of having that knowledge and that ability.
Some healthcare professionals are still in a kind of paternalistic world where they talk about a GP record. It's not a GP record, it's a patient's record. And there shouldn't be any debate about whether GPs hand over their records to patients. The debate should be whether patients hand over their records to us.
What we're really aiming for in the patient-doctor relationship is a sort of shared decision-making process. And there are specific tools which have been developed which facilitate that process towards shared decision-making. Those are not used very widely, and they could be used much more widely. So that would help, again, make the doctor aware that it's their responsibility, or any health professional, that it's their responsibility to encourage the patient to participate in the process. And also the patient would be given permission, as it were, to ask questions, to interact, to do research independently. And that leads to a much better relationship between doctor and patient, definitely.
So a big part of the challenge in the new contract between the NHS and its patients is an educational one. It's helping people come up to speed with what they need to know in terms which they can understand and control about their own disease. And we're seeing this much more.
The future role of patients in the NHS, I think, is probably quite bright in that there's now a huge recognition that they should be more involved in shaping services.
The best healthcare systems are those that engage patients both during the time they're in hospital or in other setting where they're using the services, or retrospectively.
It's first and foremost about actually allowing patients the opportunity to engage, to speak, to talk. Sadly, because of how the NHS has historically engaged with patients, we've often disempowered patients and made them hesitant to talk to us, to help them get involved. Too long, the NHS has gone to patients and said, we're wanting to do this to that service. In reality, what we need to do is go back several steps to talk to patients about, well, for you, what are your priorities?
Slowly but surely, we are working with the professionals. And I think that's what it's about. It's about volunteers working with the professionals, but the professionals knowing that we're not trying to step on their toes. We're trying to cut that in-between time where a doctor has 10 minutes for an appointment with each patient, and the patient doesn't get everything out within that, or they're sat there wondering, what do we do? How can we do it? And they've forgotten everything that they need to speak to the doctor about. So why can't we have a volunteer health champion in the surgery with a sheet that's got some questions, get the most out of your appointment. Use it, fill it in. It works.
We own our bodies, we own our minds, and if something is being done to you and with you, surely you're the person that should be at the heart of the thinking. And when you get people that come out of a consultation or have been speaking to a nurse and then they're trying to second guess, what were they talking about? What were they saying to me? That's really not good enough. So it is about tuning in, having user-friendly language that's easy to understand, good quality literature, but also things like telephone numbers and people to talk to if you're unsure or unclear.
A much more grown-up and useful and productive discussion is to go to the public and say, here is the resource that we currently have in this particular area. This is the amount of money we're spending on diabetes or renal medicine or cancer or mental health. We've got some ideas for how we might spend it better, but what do you think?
I think what's really interesting over the last 60 odd years since NHS came into existence is the issue of trust. Patients, when NIBEV informed the NHS, were very grateful for the fact there was a health service where previously there was none, and implicitly trusted doctors to do the right thing. What experience has shown over the last number of years with things like the Bristol Heart scandal, with mid-staffs, is actually some of that trust was possibly misplaced. And it wasn't necessarily always the case that care patients receive was always of the best standard. And what that's done is start to damage the trust that patients have in the NHS. That's really why patient empowerment's the key to this, because we need to rebuild that trust and re-establish it based on solid, credible facts.
I saw a fascinating interaction when I visited the hospice in Exeter. They have a relationship with the Peninsula Medical School, and this is what happened. A group of medical students, obviously pre-arranged, came to the hospice, and I was invited to sit in on this. And there was a circle of people who were suffering from cancer and were at the hospice, all of whom had terminal illnesses. And in an outer circle, the medical students and myself sat there, and the people, the patients, then talked through their experiences about what it was like to be told that they had cancer. And what we got out of that was the good experiences, how people talked about people that were very sensitive and very tuned into the needs of the individuals, and some that felt it was a little too blunt and a little too cold. And that is the kind of imaginative thinking that I really do think brings to life when you talk about the patient experience.
We recently felt that there was a need to redesign our out-of-hours services, but we were very much aware that was a need of a commissioner, and we had concerns about the manner in which it was delivered. We didn't know what the patient's perception was. So first and foremost, we actually started to talk to patients about, well, why are you going to out-of-hours? What do you feel about out-of-hours provision that's done locally? What do you feel are the problems facing out-of-hours? And equally, what do you see as other solutions to do that?
London went from an area where stroke care was patchy, with some of the best care in the country, but some of the worst care in the country, to what now is probably delivering the best stroke care of any capital city in the world. And we wouldn't have made those changes without profound patient involvement in the design.
I see the role of the more experienced patients who want to take that confidence and knowledge and basing on their experience to help inform the whole planning of the health system.
Patient choice in this day and age is important, and certainly some patients want choice, and they want to choose when they have an appointment, when they see a specialist about having an operation, and if they have an operation, they want to choose when that is. They also want to be able to choose when they can see their own GP or how they can see their own GP.
What we need to be doing with the public is helping them to feel much freer, whether it be with their GP or their specialist or their nurse, to ask questions about what can I expect, where do you recommend, who's best at doing hip replacements, and these kinds of things. It's about patient empowerment, it's about public empowerment.
You know, a patient who comes in to me to see me as a GP and needs, say, a hernia repair, and I can offer them that hernia repair in a wide range of different hospitals. But actually they need help navigating the system because they don't know how to choose between all the different hospitals. So actually it's choice where it's important and for those that want it.
It's very well understood now that, for example, parents have to have a greater choice of school, different types of school to choose between those. We can see the same in local government services, a much greater range of providers using those services. But much deeper than that, the most go-ahead leaders of public services want to see the users of services as a real resource which they can harness to make those services better and to solve social problems. So, there's a sense that the health service needs to catch up, but there's a lot of very good experience which it can follow.
Over the last sort of decade, there's been lots of targets set around making sure that access improves, and those targets have been primarily aimed at secondary care. And they certainly have improved the access across the secondary care sector in terms of 4-hour waits in casualty, in terms of 18-week waits to have your operation after being referred for treatment. Where there's been less emphasis is on making sure there's access equally to community and primary care services.
So we need to create alternatives to high-cost A&E and even GP services, such as consultations in pharmacies and even nurse practitioners, as well as telephone consultations in the future, so that where people need reassurance and need the feeling that somebody's listened to their problem, they can get that without spending the 170 plus, which it costs for somebody to be seen in an A&E service, and it can be done much more quickly.
Using online services in order to book, cancel, change appointments, even consult with their GP is the way forward.
There are aspects of our life which are entirely digital. I've not been into a bank. I can't remember the last time I went into a bank. I virtually never go supermarket shopping. I book all my holidays online. We don't interact with the healthcare system in the same way. When I try to, with my local GP surgery, I tried to book an appointment recently. I still can't book an appointment online or email my doctor about my condition.
A patient-centred NHS would first of all be an NHS where it'd be easy for the patients to get a service. But secondly, and even more important, be a service in which the patient felt that their interests and their concerns had been listened to and been taken into account in treatment planning.